we're going to talk about short-acting birth control methods, the most common being birth control pills. And these work, the birth control pills, and we're going to talk about there's estrogen and progesterone only, there are patches, and then there are vaginal rings. They all work by absorbing hormones into the bloodstream that then go up into the brain and tell the brain, hey, there's lots of estrogen and progesterone, so the brain doesn't send a signal to the ovaries to make ovulation happen. So they block ovulation. If you don't have an egg, you can't get pregnant. So the ovulation blockers are all of the different kinds of birth control pills. The most common one that we're familiar with is a combination of estrogen and progesterone. And that one can also be found in patches that you place on the skin, as well as vaginal rings. They have a combination of estrogen and progesterone. They all work by blocking ovulation. And then the side effects from these products, estrogen products especially, you have to worry about triggering migraine headaches. So if someone has a very strong history of migraines, especially if they have an aura where they see the little flashing lights beforehand, they should not take an estrogen combination pill because that could increase their risk for stroke. So we have to be very careful. Now, on occasion, women will have premenstrual migraines, and they can actually improve taking a birth control pill. So in some patients, we'll try it to see how their headaches do. If they get worse, we just stop it. Estrogen also can cause blood clots. And if you have a genetic predisposition, like a factor V Leiden deficiency or something like that, you have to know about your family history a little bit. So if your mom had a blood clot when she was pregnant, a blood clot in the legs called a DVT or deep venous thrombosis, or she had it when she was on the birth control pill, then you really need to be checked before you just start an estrogen combination pill. And anyone with liver issues, because the estrogen does go through the liver, it can irritate the liver in some women, so you have to be careful with that as well. Other things, estrogen can cause nausea. It's less likely now with the lower doses we have, but when the doses of estrogen were higher, around 50 milligrams, then 35 milligrams, then 30, you would have more nausea. Nowadays, I like to use more 20 milligram pills of estrogen, and those have much less nausea. Also, the first 3 months is a tough time for some women. They'll have a lot of breakthrough bleeding, meaning that they will get their withdrawal bleed period, but they'll also get some spotting in between. And then maybe they have an increase in moodiness the first 3 months. So a lot of times when women start the pill, I always say, well, first of all, you have to take it as close to the same time every day as you can, because otherwise you will have more breakthrough bleeding. And then, of course, if you're forgetting to take it, it doesn't work. The first 3 months can be rough, and then patients sometimes can improve and feel a lot better. Now, more data has come out in the last few years about depression and anxiety. Definitely connected to these combined estrogen-progesterone pills. They've done some pretty good studies that have shown that women are more likely to go on antidepressants, for example, if they're taking this combination pill. I had a patient not too long ago. She's in college, started a regular birth control pill and felt like it changed her personality, and we stopped it, and she immediately felt better. So we have to be careful about that. Also, some women will report a decreased libido or a decreased sex drive. The studies don't really say yes or no with this, but again, every woman's different, and if a woman thinks it's possible, I have them stop it, and then if they feel like they go back to normal, of course, then we don't use that. That's not a good method for that. And it makes sense in that estrogen increases this something called sex hormone binding globulin, which is a protein that binds testosterone or any male hormones that we make. And so if you're going to bind more of that, it cannot work. And that's probably why those pills could have an effect on libido. Then the other issue is weight gain. In general, the studies don't show a weight gain. However, there are patients I know who will say that they put weight on. There's no doubt about it. And then telltale sign, they stop it and their 10 pounds goes away, right? So it can happen. And so everyone is different. It may not happen to a lot of women, but it can happen. So we have to be mindful of that. The other thing that can happen with birth control pills is that you can sometimes skip cycles. So in reality, when you're on a birth control pill, you're not making a lush lining for an embryo to implant. So when you bleed, it's not a real period bleed where you have to shed the lining. It's actually more of a withdrawal bleed. So when you stop the estrogen and progesterone, then your body automatically bleeds, but it's not because you have a big lining you need to shed. So I always reassure women that it's okay not to have a period on the pill, other than if you're going to be nervous every time that you're pregnant, right? That's not fun. And so then we'd switch methods, and someone who that happens to and they just don't like it. I always recommend doing a pregnancy test if that happens the first time, because especially if you haven't been using it as well as you'd like, we have to make sure. But in general, they can cause you to skip cycles, but it's not a real period on the pill. It's called a withdrawal bleed, and it's to make us feel normal. That's why when women skip cycles on the pill, I think that's okay. It's safe to do. With progesterone only, the biggest issue is that you will have irregular bleeding, because progesterone there every day blocks the estrogen from building a lining, and then the lining just, whatever's there will shed randomly with progesterone. So the biggest reason women will stop those is that they just don't want to have that kind of unpredictable bleeding. You can bleed randomly. Some women get periods, some women don't. However, the longer you're on them, the more women will not have periods, and they don't mind a little spotting every few months. So it can be a great method, as can the regular pill, estrogen and progesterone, for women who have horrible menstrual cramps or who have heavy bleeding. So in those women, the birth control pill really does eliminate menstrual cramps. It's great for that. So different kinds of pills, different dosing. My favorite is a 20 milligram estrogen pill, because there's a lot of generic versions. There's a 10 milligram, but at this point, there's not a generic version of that. And so we have to worry about cost. There are multiple generics, multiple kinds, and they're pretty darn cost effective. You do have to take these things as close to the same time every day, especially with progesterone-only pills. So let's move on to those. So remember, with progesterone-only pills, you're not going to get a regular, predictable period. And the mini pill, which has been around forever, is progesterone-only. And the reason they call it mini pill, it doesn't have estrogen. Mostly used in women who are breastfeeding, because estrogen can decrease breast milk. But some women who can't do estrogen will take the mini pill. They're not as effective. They're generally 96, 97% effective with perfect use, where a regular birth control pill is 98% effective. And again, they all drop in effectiveness because of how women use them. If you're not using them correctly and you forget all the time, you're not going to be 98% effective, right? So, but mini pills, the reason they have a little less effectiveness, even down as low as like 71%, is that you have to be meticulous, taking them as close to the same time every day as you can. Because if you don't, you can ovulate, right? So it has a lot of, you have to be perfect taking it. However, there is a new one. There's a new one called Slynd, S-L-Y-N-D. And the cool thing about it is a progesterone-only pill, but it's a different kind of progesterone called drospirenone. And what that has a longer half-life. So you don't have to be as perfect. You still need to try to take it as close to the same time every day. But because of that, the effectiveness is about the same as a regular pill, which is really awesome for women who want to take a pill, but they can't handle the estrogen, or the estrogen causes depression or something. Now, progesterone only can also cause some increase in moodiness, depression, anxiety. However, it seems like maybe it can be less in some women. So again, everyone's different. You'd have to try it to find out. The other really cool thing about progesterone only is that if you have a history of deep venous blood clots, that new one called SLIND, 40% of the women who participated in the trial had a history of deep venous clots or DVTs. So they did not have an increased risk, which is really nice for women who definitely can't take estrogen for that reason. And then the other kind of cool progesterone only pill is called the O pill, and it's over the counter. So you can actually buy that pill over the counter. Now that one is more of a mini pill. So again, it's effective 96 to 97% with perfect use. However, it's going to drop if you're not meticulous taking it at the same time every day, but it is over the counter and the cost is about $50 for 3 months. So that's not bad. So that's in short-acting progesterone-only pills, estrogen and progesterone combination. And then the combination estrogen and progesterone can be found in patches. There's one called Xulane. It's Xulane. And there's one called NuvaRing. That's Badgering. I'm sorry. There's one, the other name for it is Twyla. Now, the first patch that I was talking about called Xulane is like the old Ortho Ever patch. It's 35 milligrams of estrogen, a little bit higher. And the new one called Twyla is a little less estrogen. It has 30 milligrams. Both of those, you keep the patch once a week. You put a new patch on, and then you don't put a patch on the fourth week so you can have that withdrawal bleed. Some women will use it continuously and not take a week off because they don't necessarily want to have that withdrawal bleed, and you can do that. That's off-label use of it. So Xulane and Twyla are the patches. Can't be used in obese women because the effectiveness is less. Okay, so you have to be, that's not a good product for those women. Then there's the NuvaRing, which has been around for a long time. You keep the ring in the vagina for three weeks at a time, and then you take it out to have that withdrawal bleed. And again, some women don't. They just leave it in 4 weeks, take it out. That's off-label use, but they do that. And you leave it in place when you have intercourse. Can't tell it's there. If it happens to come out, you just put it back, but that doesn't happen very often. Very effective, higher dose of estrogen, maybe a little more of an increased risk for blood clots. Then there's a new ring called Anovera because it's annual. You get one a year. You keep it in for 3 weeks. You take it out for a week to have that withdrawal bleed. And then you just rinse it off with soap and water and put it back in a week later. So that's a new product called Anovera. With any of these estrogen and progesterone combinations, you have to be mindful of, like, if you take any seizure medication, you have to be careful because certain things will lower the effectiveness of those. The only antibiotic that really does it is one called rifampin, which is used to treat tuberculosis. So most antibiotics really are okay. But you can always double check. You can always look that up if you're nervous about that. Depo-Provera shots are a shot of progesterone that you get every 3 months. So it gives you a big dose of progesterone, and then it slowly comes down at the end of the 3 months. Really don't recommend that one very often. I use it to treat endometriosis patients if they're in a flare because it has a lot of side effects. It definitely has an increased risk for weight gain or water weight gain sometimes, moodiness, and it obviously disrupts periods because it's a progesterone-only product. And it can temporarily decrease bone density. So I don't really like that it has an effect on bone density at all. And so that one, you have to be careful using it. But there are some women who it would work for them, and that's the Depo-Provera shots. Let's see, what else? I want to, Phexxi is a new spermicidal gel, and it's about 86% effective. So again, it's not the most effective method on its own, but it's a prescription spermicidal gel. which is interesting. And it is not as irritating as the regular spermicides, like non-oxynol 9 is the most commonly used product. That can be very irritating to the vagina, and some people worry that that can increase risk for sexually transmitted infections or HIV even, because it's irritating to the vagina. Well, this product is different from that. And the only thing I can say is 86% effectiveness. It's not cheap. You get 12 for around $300 by prescription. So good in combination with other things if you really have to avoid pregnancy, but you don't want to have to, you want to use it in combination with something else.